Welcome everyone. Thanks you for coming today on a day off for some of us. Before we start, I would like to make the land acknowledgement that we respectively acknowledge that we are gathered on the ancestral homeland of the Beothuk and that the island of Newfoundland remains the unceded traditional territory of the Mi'kmaq. In Labrador, we recognize the Inuit of Nunatsiavut and the Innu of Natisanan and the Nanunatukavut Inuit as the original people of this land. We honor their enduring presence, cultures, and contribution, and recognize our shared responsibility to advance reconciliation through meaningful relationships and actions. Say no more, starting our day. If you are sitting here with us, this is our new space, which is our latest social enterprise for event space. If it seems too small, you should have been with us 5-6 years ago. We used to have a one-bedroom that we all sit in to operate our first operation. About 8 people sitting next to each other. We didn't call the city to do any inspections at the time. But at the time, we thought how to grow, and here we are, 8 years later, 12 buildings, 75 staff, and a lot of projects that we will be talking about today, in addition to housing. Thank you all for coming today. Our growth over the last 8 years is something that didn't happen just because we had leadership, as a lot of people attribute that to, but we had a great team. A lot of people have joined our team and made a difference to our organization, starting with our board and ending with each and every one of our team of Connections for Seniors. Today event, they told me that I have to make an acknowledgement at the end, but a lot of people at the end don't hear that, so I want to make it at the beginning. Our team have made this day happen. Mike, I give him a lot of tasks in the last minute, and he didn't panic, at least on the outside, but he got it done. Everybody, Kathy, you did great. I wouldn't be able to do all of this. I'm usually running around or traveling or on the phone, but things are smoothly moving in this organization because we have a great team. And I don't mean to mention everybody because we do have 75 plus staff, but each and every one of them have made difference in this organization and still making difference. So I will make sure that also to mention that this week is a housing week in our city. We have a huge event with CHRA, and there's a lot happening this week with housing. So we made sure to have this close by, as a lot of us are in that mood to listen to what's happening across the country and sometimes even across the world, which we will be talking about more today. Our conversations are always coming from how can we make more solutions and make our community better. Community organizations' existence, that's the whole reason for them. They are supposed to fill in gaps and create solutions. They are not to replicate, they are not to imitate, they are supposed to find where there's no solution and then they come in with their solution. If that solution is permanent and there's no more problem, whether they find another problem or they cease to exist or join another organization. That's our philosophy and that's our culture that we work with in our organization. I am Mohammed, just in case you don't know me. I joined Connections for Seniors 8 years ago. I was 001, or 001 as they call, the first employee. And now we're lucky that we have hired hundreds of people between trainees and students across the province of Newfoundland and Labrador. I'm gonna introduce our Minister, Craig Party, our Minister of Seniors, and a lot of other portfolios. I'm sure it will be great, but I don't want to be in your position, Minister. There's a lot to carry. Say no more. The floor is yours to do our opening remarks, and please welcome Minister Party with me.
Thank you very much. It's indeed a pleasure to be here. Anytime that you can gather with the people that we have in the audience, whether it be the City of St. John's, the Connections for Seniors, my MHA colleagues, Mr. Din and Ms. O'Leary, it's a good thing. And I think when we look at solutions for housing, that's a wonderful thing. So anyway, it's a pleasure to bring greetings on behalf of the government and the House of Assembly for all of us. There are more things that unite us in the House of Assembly than what divide us. And for effect in language arts, I probably ought to repeat that, but I'm not, because keep the time frame down. But it is. We have a lot of things in common that we value. Housing, seniors initiative, affordability, they are all initiatives that all 40 of us in the House of Assembly hold dear. They're ones that we want to move. The goal is that our plan ought to be is that we would listen, we would respond, and then we would act in a way that would serve the seniors, the deserving seniors in our province, to a way that all 40 of us in the House of Assembly would like to see done. We know there are no two plans or no plan that would be fitting for every locale or every situation. There are none. I know MHA Din and I spoke lots on education, which is my background. And two of us would agree that we know that if we were in a school and we did the same, the way we taught in a school and we did the same thing, you know that you're immediately off track. And why you would say you would be off track if you treated everybody the same? Well, I'm a visual learner. I like to read in order to understand what I've got to truly engage. I sit by a colleague of mine in the House of Assembly, a ministerial colleague, that I would think he's auditory. He learns best when he's listening to it. So we've got multiple intelligences that if we did the same delivery all the time, we know we're not capturing it. I stated a little over a week ago that the budget will be coming very, very soon. I think I may have been quoted in the media as very, very soon. Well, I can tell you now that the budget is coming very, very, very soon. That doesn't give you any information, but we know we're not far off. And I would like to think in that budget, under the current government, affordability will be addressed. Three things we ran on in the House of Assembly. I know we talked about affordability, and in affordability, we talked about lowering taxes, making life more affordable for Newfoundlanders and Labradorians, seniors. We talked about safer communities, which is something that we've heard from the people of Newfoundland and Labrador. And another thing we heard from people in Newfoundland and Labrador is that we aim and desire better health care. So today's lesson on affordability, today's lesson is on housing initiatives. And I would think, as I said to Mohammed earlier, which has to be congratulated for the initiative and the growth within 8 years of this organization, which is phenomenal, it is big on collaboration. If we collaborate, we can move mountains. I really believe that. If we can collaborate and we collaborate well, we can move mountains and we can achieve big things. President Stubb is in, apparently, from the media reports, President of Finland is a very close friend to our Prime Minister Carney. And I said, I know when I saw the agenda today that we're going to look at a model from Finland, I said, well, a little bit of a coincidence. But lots of times, really good models and best practices, once we're aware of them, it negates the need for a study. And once we know that we've had, and once we realize that we have something that works and works in a similar jurisdiction, then that brings us closer to making sure that we found something that could work in our jurisdiction. Most seniors want to stay at home. We will need initiatives in this budget coming out that allows for that. I know we talked of thresholds that are being too low. We need to revisit the thresholds that allows people to gain and enter or receive benefits. That's got to be done on a more fulsome nature than what we've done, but we've made inroads in what you'll see in a short time in the upcoming budget. So it's very complex, but again, I stand that the government of Newfoundland and Labrador and all members of the House of Assembly, 40 of us, the City of St. John's, organizations such as the Connections Group here for seniors. If we work together, as I said, we can achieve big things. And all I can tell you is that we are willing participants, the Government of Newfoundland and Labrador, to partner and move along very worthy projects. Thank you very much for having me, and I look forward to the morning.
So, following our great speech, by the way, Minister, and we look forward to a lot of work and change happening, and we believe that's essential to our province at this point. We are the fastest aging province in the country, and that comes with a lot of responsibilities as well. So holding a portfolio for seniors is not an easy job for sure. After that, I would like to welcome, introduce Ron Ellsworth, Deputy Minister of the City of St. John's. Ron has built a long career in business and real estate and has been actively involved in community initiatives for many years. Please, Ron, please welcome him.
Mohamed's grown up a bit in the last 8 years. He went from getting no permits to coming in, talking to us about a year before he's got a project that he wants to get sanctioned. So it's been a real growth and development piece. But it's been a lot of fun getting to know Mohamed too. We've had a lot of conversations, a lot of projects, and a lot of things going on within the community, which is pretty cool. Mr. Party, to you and all your colleagues, thank you for your efforts. You have a daunting task in front of all of you, and it is appreciated, and your efforts are appreciated, so thank you for that. Mayor Breen was hoping to be here, but he's at another event that started at 9 o'clock, so we'll see where he is. Before I begin, I'd like to acknowledge two of my colleagues here with me, Councillor Jill Bruce, your Ward 1 councillor, and Councillor Tom Davis back here, your Ward 4 councillor. Good morning, everyone. I want to begin by recognizing the importance of this forum and the leadership shown in bringing people together to focus on the future of senior housing in Newfoundland and Labrador. This is an important conversation, and it comes at a time when we need new ideas and strong partnerships. I want to thank Connections for Seniors for hosting this event and for the work they continue to do in supporting older adults in our province. Housing for seniors is about more than buildings. It's about making sure people can live safely, comfortably, with dignity as they age in communities they call home. It's also about helping people stay connected to family, friends, and services, and supporting people to age in place wherever possible. From the city's perspective, accessibility and inclusive designs are key parts of that future. We need housing that works for people at every stage of their life. In December, the city launched the new resources in partnership with Universal Design Network of Newfoundland and Labrador to support universal design in developments. These resources are meant to help help developers and builders include universal design features when creating new homes. When homes are designed this way, people can stay in their homes longer, live more independently, and age in place with greater stability and dignity. We are already seeing strong examples of projects that are taking this approach, and we encourage more of the same. More broadly, the city's role is to help create the right conditions for housing to be built. This means reducing barriers, improving timelines, and working closely with our provincial and federal partners. We are doing that through a number of initiatives, including waiving permit fees for affordable housing projects, prioritizing housing applications, reinvesting development fees back into community-led housing, and using city land and incentives to support new construction. Programs like the CMHC Housing Accelerator Fund are also helping us modernize our planning system, support appropriate density, and reduce delays so projects can move more quickly from concept to construction. I want to take a moment to touch on some of the work happening as part of the action plan for this fund. Our multi-year purpose rental incentive program is also helping move projects forward. It provides fee exemptions of up to $100,000 to support construction of much-needed rental housing, including building, plumbing, and electrical and development fees. To date, we have 15 projects that have used this program, with another 10 at various stages of overall supporting 340 units to be delivered. We're also supporting gentle density through the Half Homeowner Grant Program, which has been very popular and reached full capacity. This program is supporting the creation of approximately 100 backyard suites, tiny homes, and secondary units, which are especially helpful for seniors with changing housing needs who may want to stay close to family. For example, Approximately 25% of the units being built under this program have been identified as being created for senior parents, 8 of which are accessible. We are also advancing work with the Canadian Mortgage Housing Corporation Housing Design Catalog, which is another important way to help, making housing faster and more affordable to build. It includes 7 pre-designed housing options, ranging from backyard suites to fourplexes, stacked townhouses, and sixplexes, with 5 of the designs offering optional accessibility floor plans. These designs are developed by architects and engineering professionals and align with local building codes and development regulations. They are available at no cost and can help reduce both design time and cost while supporting housing that is accessible, energy efficient, and climate resilient. Site-specific reviews will need to be required, but this tool helps many projects move forward quickly. At the end of the day, solving housing challenges facing the overall community will take all of us working together. Different levels of government, community organizations, and the development sector. Thank you again for the opportunity to be here, and thank you for the important work you are doing to help shape our future in senior housing of our province. I wish you a productive conversation throughout this forum and look forward to ideas and actions that may come from putting our heads together. Thank you.
Thanks so much, Deputy Mayor Ron. We thought about a small blurb about who we are, what we do. Because housing is a big issue, a lot of organizations or a lot of partners don't see sometimes what other work we do in the community. Usually housing is about 50 to 60%, depends on the season and the programs, of our programs. But our organization have way more departments and essential work in order to keep housing alive and to keep people housed. And to keep these projects or these programs of housing actually functional, you need other services. When we started Connections for Seniors 8 years ago, the idea was not to deliver programs the same way programs are being developed all the time. We have seen shelters treated as a head and bed. Someone go to sleep, get a meal, and stay there. And we have seen long stays in shelters. And that was the first catalyst for us to move in a different direction and said, this is not how shelters should be. And that was the beginning. Shelters needs way more programs in order for people to actually get out of them and stay housed. Transportation was a big part of it. We've seen people stay in shelters for a long time, not being able to just simply go and get their ID done or get paperwork done or see a doctor because they need certain paperwork for their long-term care or personal care home, and so on. Outreach, following up with people to stay in the community and to stay housed in the community. So it was about building an ecosystem that actually make people remain housing. So yes, when we started, our philosophy was around staying housed, but then very quickly developed into the idea of the social determinant of health. How many factors out there that we need to be considerate for in order for people to actually remain at home. Eventually, when we say, I'm living in my home, happy and safe, there is a lot that comes underneath of that. Means I'm not socially isolated. Means I have access to services. Means I feel safe where I live. Means a lot of other things. Means there's food on my table and I don't have to choose between my power bill and food. So we had to invest and create programs as we go. Our first program was the housing program when we first started. And our emergency shelter was our first program at the time. We started with 4 beds and now we are at 47. Our portfolio and our operation is the largest operation that we have right now financially, and about 50% of our operation is related to housing between the emergency shelter and our supportive housing program. And we also think about the continuum of care. So our personal care home in CBS now, Cherry Lane Manor, is our first step into the housing model that we're also considering the health aspects of housing, physical health particularly. At this point, we are in different areas that we are looking into expansion. I'm not going to allude to a lot of our programs expansion today. I'm going to focus on housing, but we do have in our every portfolio, we have an expansion plan that we're looking to grow these programs so we can cover the rest of the province of Newfoundland and Labrador. Intergenerational housing is something that we have been having a conversation about a lot, and Jennifer and I have spent a lot of time having these conversations. It's very important when we are building housing models that not to just fix the problem, it's to create a solution. When you fix the problem, is that you give somebody a key to a place to live. But when you actually fix the solution, you look at their actual needs and you meet them where they are. Having intergenerational housing is one of those models around the world that have been thriving, helping intergenerational knowledge, helping the passing on of these wisdom and these knowledges and teachings as we thrive and live in our community. Building seniors' homes alone or seniors' housing alone is a form of social isolation to an extent. And we want to keep that flow of knowledge and information and interaction in our community. So there's a lot of benefits that come from such a model. You can think about there's challenges too, but we try to be as positive as possible and try to look at what we can do better and how we can fix these problems moving forward. Right now, we are operating 17 supportive housing units. We're operating 47 emergency housing personal care home, and we have served over 3,000 people annually, and they are in the increase every year. We are seeing a lot of seniors coming, especially through our food programs and our housing programs, to avail from the services that we provide, and we are in the route now to actually develop more data analysis through our software we just invested in order to have better solutions and better outcomes. Food security started on that room that I was talking about in the beginning of my presentation. When Snowmageddon hit, if you are from Newfoundland, you know what I'm talking about. If you are not from Newfoundland, which a lot of my colleagues here are not, we were hit with one of the highest snowfall in the last 100-year recorded history of snow. When I arrived in Newfoundland 20 years ago, people used to say, I'm shoveling out my house. I didn't understand what that means, but you're literally buried in snow and you have to shovel the house out of it. So it is an actual word, and it means what its house sounds. So it's not an exaggeration. But we had a lot of seniors that were trapped in their homes, and they said, we have no food. And phone call after phone call, I remember a couple of our volunteers and social workers at the time, they said, we're having over 20 people that don't have food on their table. And I remember I said, this is a program. This is not an emergency response. Because after that, 3 months later, people still continued to ask and refer to us. And that's when we initiated our program. We didn't wait for funding at the time. We didn't wait. We just looked at how we can do it at the best way possible, which we always take that approach before we start asking for money. And that's what we always reach out to say. It's not always about the monetization of it first. It should be about how, do we have a problem? Yes. Do we have a solution? Yes. And then we can start to invest in it in a different way. So we are delivering roughly about 250 between food hampers and meals. We have a model of a Meals on Wheels, which we call it the Rock Meals, and it's going to be called different, Jennifer. I know, but it's going to be in Compass. Very soon, we have a new branding for our programs that are rolling out this month. And we're going to be talking about how for seniors to access groceries, how for seniors to access food hampers if they cannot afford the food, and how they can get an actually healthy cooked meal on their table at a very affordable price. Transportation is the lifeline of all our programs. It's something that we are trying to keep alive as possible. We received $40,000 I think 7 years ago, and we purchased a van, and so far we have 4 vehicles, and there's no specific funding between philanthropists, foundations, and us investing in our own programs. We have created a huge capacity to our programs right now. We are connecting CBS to St. John's. This is the plan that we're working on right now. But the amount of rides that we provide per month, I don't want to quote, but I think it's over 1,000 that we, between, not 1,000 person, 1,000 ride, but between taking people from medical appointments, housing needs, food needs, and so on. These are a lot of rides that we're providing to make sure people are actually having services and can age in place and can stay home as long as possible. Outreach. Outreach is our, when you are at home and you don't know what to do about something. For example, a lot of seniors don't know how to access their benefits. A lot of seniors don't know that they qualify for old age benefits. That can lead a lot of the times to homelessness and can lead to a lot of time to crisis in their life. When you don't know that you can actually access $400 or $500 extra, and that's where we step in. We help them finding out what they need, what they are qualified for, we apply for it, and we make sure they have access to these services. This program is much more than that. We also navigate the systems for them. I find it difficult sometimes to find what to do where, especially when you're busy, but when technology is or digital, the digital aspect of services is creeping in all our services, which is great and needed. There's an education leap that needs to be taking place, and people need to learn more about how to access those services, how to utilize them, and how to be able to age in place and survive in a community or the fast-paced community we live in nowadays. So our program also do such a thing. We help with crisis intervention. We mediate between landlords and tenants in a lot of situations. It's one of our biggest efforts that we're putting out there. And a lot of our team, when we meet once a week, this is what we usually hear about, problem between landlord-tenant. A lot of prevention of homelessness and crisis can happen from just simply solving these issues and getting somebody to stay at home. I remember one of the stories when I used to work on the front line. The lady came to our program at Connections for Seniors, and I knew her from my previous job, and I asked her why she really getting evicted. And she looked with tears in her eyes and she said, "I'm so bored and I just wanted to fight with somebody." And she did, and she got evicted for it. So I said, how about that? We can take the boredom away and you stay housed. So we promised her once a week to go for a coffee, and we promised her to access a lot of the data and the information that our folks at Seniors NL, and I remember I called Kelly when she was the ED there at the time, and I said, Kelly, if you can, we can help with this. And we got the information to her, and she stayed housed until the last day of her life. She passed away now, but she was housed in her home for a couple of years after that, without being evicted because of boredom or social isolation. Social isolation can lead us to do a lot of things. We talk about being hangry and the privilege of it, but sometimes being alone at home, not knowing what's going to happen next, can lead to a lot of problems, fairly and justified. Home supports. None of our programs is working in silo. None of our programs is working in silo. All our programs are intertwined. They work together, side by side. A lot of our team members and my colleagues here, they actually work together to deliver a service sometimes. So home support is part of our social enterprise in a way, but also part of our outreach in another way. So last year, or the year before, sorry, we were already supposedly to be done with snow here. But last winter, we started our snow clearing program. And we were helping seniors to get out of their home. We have got a lot of phone calls over the years of a senior being trapped, not being able to access their medication, or a senior being trapped and not being able to get out to go to the hospital or medical appointment, and so on, or even pick up their groceries. So the snow clearing program was one of those programs that we wanted to achieve that with. And right now we're trying to function in a social enterprise perspective in order to fund those who cannot pay for it. So if you know, it's open to everybody on the social enterprise front. We have had businesses, partner organizations, families that call us to avail from our program, and we're also help seniors that cannot afford that program to access those services at no cost or lower cost. These are the present programs, and moving from here, we're going to be talking about our future and in the works programs that we're working on. And as much of you, or a lot of you are actually, many of you are looking forward to hear about. So one of our main goals as an organization is to work collaboratively with everybody else. There is nothing of what we do that we want to do alone. When we started this organization, I remember before starting, my research was like, what's out there for seniors? And sorely the answer was close to one, which is only one organization that was servicing seniors across the province with delivering certain services, and that was Seniors NL at the time. I met with Elizabeth first. I called and I said I would like to come. I didn't know Elizabeth knew me, but we walked in and she was very welcoming, and she said, this is a service that we really need. We need to advocate and help people with case management and more support service. And I said, okay, so we are on the right track. And we started to talk to some government partners at the time, or some government officials, of, do you want to see this in the community? And they said it's something that, and that was the trigger of how we started too, that nobody want to touch it because it's a lot of work. At the time, we didn't have the capacity to collect data. So I remember I was using my iPhone every time we get a phone call to actually register it on my notes. I remember having an Excel sheet that I had to enter every time that I speak with somebody. I remember at the time we wanted to show the volume and the quality of what we're providing so we can actually get the proof of concept delivered. Now we're lucky enough and privileged enough to have softwares that do that. And I didn't mean it didn't exist 8 years ago, it did. It's just we couldn't afford it. And now we invested in that, and we have now the materials that we can support that. So Advocacy and education is a big part of the work that we want to do, is a big part of where we want to go with what we're doing. So this year we're investing heavily in collecting the correct data and to work on what we have in order to bring like a very clear and vivid picture to what are the needs in our province for seniors. It's not just about this is needed, let's do a program. It's more like this is the volume of what we need, this is the problem we have, and we really need to bring everybody else with us. And that's what I think the beginning of every solution could be. Partnerships, the right information, and then we start to create a plan to move forward. The only thing is that we do it much faster, and I realize that. And that's why community exists, because community is not limited by every 4 years we have an election or every change, and that's part of the life we live, and that's something we can live with, but we can avoid these obstacles if we build programs in the correct way and partner with each other in the correct way. So moving forward, it's something that we'll be heard doing a lot, education and advocacy within our programs and teaching about what are the outcomes of these learnings that we want to do. And we want to work collaboratively with every single partner in our province, and we are always taking those steps to secure those partnerships and work closely with each other. Right now, we are about to launch our Seniors Zone. Seniors Zone is basically an app, and that's as simple as I can put it. But it's a web-based app that will deliver services for seniors in our province. It's something that we have been in the works for a few years now on our end. We have got some funding to develop the app, and we are very close to the launch of the app. The goal of it is to help seniors with digital education, something that will be at their fingertips, so you don't need to actually register to go somewhere to sit down and learn how to use your new phone or how to use your tablet. It's something that someone in your family that know how to access this, they can teach you how to do it, and then our senior will be able to learn the basics, and then from there they can build. It's also going to be a place that seniors can access news for what's related to them in the province. It's going to be something that they can access information, and like seniors, they will be able to even help them with social isolation. They can chat with each other at some point. This app has a lot of dreams to be the place for seniors to actually meet and connect with their community and with each other in different avenues. When we were starting it, I remember the developer, I told him everything I want, and I said, before you just freak out, because usually developers want very specific layout. I said, this is the goal, but you can start here. And we give him very specific starting point, and he said, that's doable, but what you're telling me is going to take a while. I said, understandable, but just when you're building the app, have it in your vision that this is where we want to reach. I don't want you to build something that looks, in lack of better words, lame and not usable. We want something that actually people use and be excited to log in and get it to use and benefit their day-to-day life. So at this point, these are the programs that, very in a nutshell, usually it's about an hour and a half to explain what we're doing. Also, quickly, which people usually tell me 5 minutes. Today, we didn't tell anybody to do that. So if you go beyond the time, you're not going to be able to leave because we're going to lock the doors. But at this point, we want to move housing, and we want to talk housing today. This is the topic that we're really excited about. This is our biggest portfolio right now. When we talk housing, we're not talking about, we have a project down the street that we're building 50, 60 units or 100 units. We're talking about, again, an ecosystem of housing. There's a lot of work that happened in the beginning. We are talking about this because we want everybody to learn about it. We want to help others to do it. We also want others to join us in that journey. There's partnerships on a national level, there's partnerships on a provincial level, and there's partnerships on an international level. There is this kind of work that we do is not just an organization that is leading it. There's businesses involved, there's contractors involved, there's engineers involved. There's a lot of work. When they tell you build affordable housing, they tell you how much work you're going to do. And we want to be honest and transparent about that. We want to open up the ground to say, reach out if you need help. Reach out if you want to do it with us. There is no reason for us to compete in this province, especially in social housing field. There is reasons to collaborate and partner. Once we start to fight over resources, the only one that get affected is the end user, which in our case, seniors. And in others are youth, older adults, women, other people that are not going to be benefiting from us jumping on the same resource, getting 50% of our fund, rather than we all go together and get 100% of what we need in order to get this accomplished. Also, it makes sure that we're not redundant and we're not repeating the services that we're giving. We're not creating a project that will do 50% and the other project will do 50%. We can all do together the 100% and make sure we're delivering best practices and we're learning from each other as we move forward. So, the remote. There you go. This is just a blurb of who we are as a province, who we are targeting. We're targeting the Newfoundland and Labrador province. Our province is roughly about 550,000 individual. 1 in 4 people in our province are seniors, are 65 plus. About 33% are 55 plus, which we are targeting. So we're talking about 1/3 of this province that we're aiming to represent and support. We realize it's not a small portfolio, it's a big portfolio to take, but also someone has to step up, and we're not gonna do it alone, as we said. We're gonna make sure that we have partners and people that can work with us down that journey and through that journey. Right now, we are looking to develop 150 by 2027, but the ultimate goal of our organization over the next 5 years is to have 500 units that we can deliver in our province, not just in our community. I was saying at the time, I would like to for us to actually reach 10,000 over 10 years, but usually people tell me, slow down, don't scare everybody out. So I'm not gonna do that. Just pretend you didn't hear me. The model that we represented from the beginning was unique, and I'm not going to talk about it, but we are an organization that look to be self-sufficient in a lot of ways. So we don't put the burden on any entity, whether it's the government, whether it's the municipality, whether it's even our community. How can we build a model that at some point we're self-sufficient? We can actually say, we have a $5 million this year that we can utilize to build more housing moving forward. We have $100 million that we can actually create solutions. And if we don't have senior solutions, I promise that surplus will be available for others to work with us and to help other housing models to develop across the province. Our goal as an organization eventually is to create solutions for everybody. But we start with what we see our mandate and mission, and if that's resolved, it can be passed on and shared with everybody else, whether by knowledge or resources. From here, I'm going to introduce our previous Director of Strategy, Ron Taylor. Ron started with us a few years ago, and we wouldn't let him go since then. But he will be talking about how our strategy that was built 3 years ago has been delivered over the last 3 to 5 years, and how we're moving forward as well. So going from strategy to action. But a couple of things before we start that we wanted to elaborate on. We wanted to detach the idea of affordability for seniors from poverty. When you say affordable housing, a lot of people hear low income, people in need, seniors that are struggling, and that's actually counterproductive to every dream we have here. Each one of us would like to retire that housing is not an issue for them. Mortgage is not an issue, fixing their home is not an issue, paying their rent is not an issue, downsizing is not an issue. So it's not about poverty, it's about actually creating enough stocks for housing across the province, that making sure that everybody, when they retire, they just have a home. And it's not an issue for them. It's not something that I have to save on my food or I have to save on my medication, which these examples I'm giving are actually live examples that we see day to day. It's not something that I'm just trying to give like a hypothetical example. It's actually a live example that we see it all the times. Building partnerships across the province is very important for us. I mentioned that, but want to make sure that when we're moving forward, everybody else can join us, and we don't have to lead. There's a national portfolio we're working now with our partners at Raising the Roof. We're working under their umbrella. They are leading the portfolio because they have the experience in the building of these buildings. We partner with others that we tell them what we know, we take what they know. This is not about just leadership in action, but we are trying to be at least the lead in making sure that message prevails and everybody hears it out. Ron, say no more. Please come in.
Thank you, Mohammed. I love when Mohammed goes off script. He probably took about 1/3 of my presentation today, so mine will be a little bit shorter. So I think Mohammed had mentioned to you that if you look at our organization, started off 8 years ago working in one room of a house. Started out as a not-for-profit, and in the last year we got full charitable status. The interesting thing about our organization and what makes us unique is that we're run by entrepreneurs. So we're not afraid to punch above our weight and take on things that might intimidate other people. So I'm going to talk a little bit about what our strategy is here today. And so what are we trying to do? We're trying to close the gaps in the affordable housing system. And we're all aware of what those gaps are. Mohamed's going to talk about them further. And providing housing that's tailored to the seniors' needs. And most importantly is creating the housing supply. I think that we all know that there's people out there who have worked their entire lives, who have paid taxes, stayed out of trouble, and been contributing to the communities, and they find themselves now that they don't have a pension. One person may not be able to work anymore. One person may have passed away. Families break up. And people who have worked their entire lives as contributing people of our society find themselves falling through the cracks. So when you think of people that are homeless, a lot of times you get that vision of that 1%. The other 99% of those hardworking people that have contributed and built this province to what it is. So our housing solutions are community-led solutions, not one size fits all. Housing in Labrador or in Indigenous communities will obviously differ from solutions in rural Newfoundland, which will then again differ from what we build here in urban areas like St. John's. Our approach goes beyond just building units. It includes age-appropriate and accessible designs. A lot of times when you hear where older people are living, they're living in homes or places that are not built for seniors. They're not accessible. Accessible doesn't mean getting to the front door. Accessible means having things like your bathrooms, your kitchens, your sinks.
I have to make sure that I'm proud of it. But they came and said he actually was the first one in the country to bring health and housing together. That vision of them, I know we function from departmental and budget point of view, but needs, they do not separate. They are the same issues. They are the things that we should, when we talk about somebody moving out of their home, health is usually one of their first, whether it's mental health or physical health, it is one of the main issues we see. And usually it's like, no, it's a health problem, no, it's a housing problem. You know what? It's our problem. And that's when we start to get these out and see how can we integrate them. But that is on a system living conversation that we can come to in the future, but we have to start advocating for that and talking how can we bring those solutions. And others are doing it. Others are doing it. And Juha is listening to us from Finland now, and I'm sure he can allude to that at some point today. So I'll introduce Janelle Ward, our Director of Senior Housing Programs. Janelle has started recently with us, but she has been fitting right in. She's the right fit for her position. She has been doing great work. Her learning curve, I thought it would be going to be 6 months, and it was 6 days. So very impressive. So please, Janelle, join us. Please welcome Janelle with me.
I've had the good fortune of being in good hands, and I just want to thank the team here at Connections for Seniors for all of their support along the way. So today I've been asked to share a little bit of information with you about dementia villages. Just a little bit about my background. My work in dementia spans around 15 years, and I'm really excited about the potential of dementia villages here in Newfoundland. I think it's a huge gap that can be filled, and also the entrepreneurial spirit at Connections for Seniors is also very, very attractive. Okay, so just to... technical difficulties in community, right? So just to set the stage a little bit for you, I'd like to just discuss the background and the significance. So the World Health Organization has recognized dementia as a leading public health crisis of the 21st century. And it's not only a health issue, it's really a socio-economic issue as well. It has many implications in community. Just to kind of set the stage in terms of the scale of the problem, there's over about 57 million people who are impacted by dementia. And the economic burden is also substantial as well, about $1.3 trillion annually to treat this disease. And so I think, from a systems perspective, there's a lot of work to be done in dementia. Now, I just want to talk a little bit about what dementia is, because in popular discourse, This term is often conflated with Alzheimer's disease and used interchangeably, and so dementia is a set of symptoms that are serious enough to interfere with activities of daily living. It impacts memory, thinking, behavior, ability to do daily activities, and the most common type of dementia is Alzheimer's disease, which accounts for about 70% of cases. Okay, the impact is also very great. It impacts people on multiple levels, cognition, behavior, functional ability. The behavioral and psychological symptoms of dementia include agitation, and this is very, very difficult to manage at the community level. Many times caregivers are just ill-prepared. They don't have the tools, they don't have the skills to manage this disease at the community level. And it's a major driver for institutionalization, caregiver burden, and health system costs. There's been a couple of policy and system responses in response to dementia care, the first being the Canadian Dementia Strategy at the federal level, which is setting the direction for prevention and diagnosis and quality of life and supporting caregivers. The next one, in Newfoundland particularly, the Dementia Action Plan, which is centered around increasing awareness about dementia, workforce training, etc. And then in Newfoundland also, the Dementia Friendly Communities Initiative, which is very much wide and global. But here in Newfoundland specifically, it's targeting limiting barriers in the environment to improve inclusion and access for people with dementia in the community. Now, taken together, all of these collectively centered theme is aging in place and deinstitutionalization. They ask a critical question, which is often implied, and it's, what does the future of housing look like for this community, for the dementia community? And that's where the Dementia Village is offering some answers. So as Mohammed said, and I think Mohammed, you could be grandfathered in as a dementia specialist now because of your experience abroad. But as Mohammed said, it's a purpose-built environment. It replicates a home, it replicates a neighborhood, it has various amenities, and it's on a smaller scale as well, so that caregiver to care recipient dyad is a little bit less than in traditional care. It has, the grocery store, a cafe, a hair salon, walking paths, and the key concept here is to normalize life, to increase social participation and engagement for people with dementia, and limit restrictions. So Hogebeck, it's the first dementia village. It's really the pioneer in dementia villages. It's shaping the best practices in design. A hallmark phrase is life as usual. And so what does life as usual mean? As simplified as it might sound, it means normalizing life for people with dementia. People with dementia, as Mohammed said, they still have interests. They still have personhood. They still have a life outside of the diagnosis. And that's what dementia villas seek to prioritize. As I mentioned before, it's focused on small-scale living, so different households, maybe with less than 10 residents, and the ratio of care is a little bit less than in traditional settings, which maximizes engagement as well. Other countries have followed suit, so a number of international examples. Although they've been adapted in different ways depending on the context. Here in Canada, BC is really the pioneers here. In dementia villages, the village of Langley, that was the first dementia village in Canada, followed by Providence, which is the first nonprofit adaptation of the dementia village. International expansion also in Germany, France, and England. So it's really shedding light that this is the interest, internationally in the direction of dementia care. There's a couple of core principles and features which are quite interesting. The first is, shifting away from the medical model and prioritizing more humanistic ways of living. So focus on personhood and community-based care as opposed to just the disease or over-medicalizing the person with dementia. Another one is the roam-free freedom of movement environment. So in traditional settings, there's often a lot of restrictions or physical, chemical restraints. And from an ethical perspective, is that appropriate? That's questions that still remain to be answered. And so that roam-free environment, the freedom of movement, supports wandering, which is a very natural expression that takes place with dementia. And then a reduction of task-based programming. So task-based, prescriptive programming, very kind of unilateral, not taking into account what the individual would want to do and how they would want to give meaning to their life while being in dementia care. One of the most unique features is the staffing model. And I find this to be particularly interesting because the staff are actually blended in to the dementia village in and of itself, and safety is embedded in as well. And so staff are in plain clothes. You know, you might see staff as the barista, you might see staff as the hairstylist, you might see staff as the bank teller, and they're all very, very highly trained in dementia care to support those interactions while also maintaining the independence of the resident. So there are a couple of theoretical approaches in gerontology that inform the best practices in dementia villages. The first is Kit Wood's work in personhood and person-centered care. And this is focusing on the strengths that an individual has remaining, focused on their capacities and not just the limitations of their diagnosis. The next is the work of Janine Wiles and Tina Buffel in environmental gerontology, and Ron alluded to this by suggesting that sometimes even when an individual is successfully housed, the fit is completely wrong. And that's what environmental gerontologists describe with the person-environment fit, that supportive environments need to enhance function and independence. And then the social model of disability. Disability activists spoke highly in this regard about the environmental barriers that are created in society and how we can improve inclusion and access for certain populations. And this is really underpinning the dementia-friendly strategy as well. So key themes here are dignity, autonomy, engagement, and enabling environments. Now, there are several positive outcomes documented in the literature, of course, prioritizing that person and environment fit, reduced behavioral distress, increased functional ability, increased wayfinding and spatial orientation, decreased reliance on pharmacological approaches, so more inclusion of non-pharmacological approaches, that being validation therapies or reminiscence therapies, etc. And a key takeaway here is that these outcomes reflect environmental gerontology principles, where well-being is shaped again by the fit between individuals and their environments, not just the condition. So there are, I hope you're encouraged to think about some of the differences between traditional long-term care models and that of dementia villages. And I've noted a few here. It's not an exhaustive list, but, it raises some questions about are dementia villages on the same level of traditional long-term care models? Are they better? How can we make improvements in long-term care? I think from a rights-based perspective, it really asks questions. One thing I think about a lot is the restraint, the physical and chemical restraints imposed upon people with dementia, and if that's appropriate. And also the sense-making and meaning-making people with dementia that often goes underestimated in their care planning. So some key takeaways here. Again, it's not a one-size-fits-all approach. In thinking about solutions for housing, this is one of the key solutions I think that can be brought to Newfoundland and Labrador, as we're seeing massive improvements in dementia care in society. It creates a familiar, normalized environment that supports daily living. It's also adaptable in many, many different contexts. And I think dementia villages are proving to be a very sound, innovative approach to dementia care. And as we go forward, it's something that we really want to think about in Canada, particularly. Here are some of my colleagues who have contributed to this field in great ways, and I just wanted to acknowledge them today. Thank you so much for your attention, and enjoy the rest of the program.
Thank you so much, Janelle. I think it was very important for all of us to hear what is Dementia Village, how it works, what are the advantages of it, and to make sure that we're aware of what we're calling and what we're trying to do here. We're going to be talking about, we have been talking about infrastructure, what we want to develop as an organization from an infrastructure point of view, but as we spoke in the beginning, that cannot happen alone. That has to be strategized, that has to be put into action, but also we have to look how can we do that with a long-term impact. Without partnerships, we cannot do that. Without making sure that we bring everybody involved to the same table and we work together, it's something that is going to be always slower moving forward. A lot of our success is attributed to how we think, but it's also attributed to who is with us. There is a lot of people that joined us throughout this journey that made this happen. I'm going to come to that at some point soon, if that remote works. You can just do it. Thank you. Spoke about that earlier. We just wanted to refresh that information before we start representing our partners and talk about what projects are we whether working on right now or in the plans of getting delivered. Some of our projects are still in the planning, have advanced from the planning stage. We're going to be talking about that very soon. There is a strategic expansion across our province that we're looking through to choose the main hubs of the highest condensed or concentrated population across the province. We have a very unique layout to our province. Some communities are 50 people, some communities are 5,000, and some communities are much bigger than that. But we cannot exist at the same place or every place at the same time. We have to strategically make sure that we're making the right choices of where we're going and how we're growing. Building strong pipeline for long-term impact is something that we really keep focusing on to make sure that what we're building is not for the next 5-10 years. It's something that is self-sustainable and it's maintaining itself on the long term. Whether by thinking as social entrepreneurs and making sure that these buildings are built in a way that is self-sufficient and taking care of itself, or by making sure that we have the right partners in place and partnership in place to make sure that this is as sustained as possible. Right now, our organization is ready to go and shovel ready with 60 units housing apartment building. The plan for that building is that it will be, first of all, fully accessible, not 20%, not 10%. We are building for seniors, and what we build should be a place that we can age in. I should not tell a senior, I'm so sorry, you have to move out because you cannot reach up high to the sink, or you cannot be reaching up high to a countertop. It should not be built that way. Homes are built so they can be for the person as long as they want, not as long as they can. So if it's detrimental, we cannot make them live there, that's a different story. But it should be really at the last, 2% of our battery lifespan, for the lack of a better analogy. But I shouldn't be moving out when I still think that, okay, I can function everywhere else if the place was a little bit more accessible. So we're building that with that in mind. So the total amount of units will be 60 units. It's close to downtown for you that are not from here. It's an approximate walk distance from the hospital, very close to downtown area. I call it downtown. If you didn't arrive to Newfoundland 20 years ago, they call it the West End. But I refuse because I do live downtown, which is called the West End as well. But it's the historical downtown area of St. John's, which I understand but don't agree with. Thank you. A cornerstone of our housing strategy, this is our first big project. We have invested in very small, low-density housing models in the beginning, and that's because that's the way we could have done it. When we started this organization, I was going to open with this, but all what we had was $12,000. And now we couldn't invest to purchase houses at $50 million project or a $20 or $50 or $60 million project, which I'm coming to that after. But that project now, we are lucky that we secured all the aspects of fundings in whether approval or conditional approval, but we have the funding ready to go. We are now discussing our contracts in order for us to move forward in releasing the fund and actually develop those 60 units in 18 months. And that's on Dave. He promised me that. Dave is our Northbrook partner, and we have a lot of conversations about this. One of our biggest and fastest moving projects, I was very impressed with how the town came forward. We asked, they met with us, their MHA at the time, or still there, Joe Power, he reached out to me and he said, what do you guys need? And we had a meeting with the town, and we spoke what we envision and what we would like to, how to make this happen. And they said, so what do you need? And it's good to be prepared with an answer. And it's good not to say I'm going to go back to my team and discuss, especially in conversations like that. And we said we need 1, 2, 3, 4, 5. And we knew what we need because we have done Alexander Street now and we know exactly what's needed for it. And we have been doing a lot of work on looking into other development and housing development models. And at the time we said we need 4 things. And they said, done. And they, within 1 week, they issued a letter that they designate that land to us. That land is now part of our project. We put it through our portfolio. They're raising the roof to put it through to Build Canada Homes, and it's been submitted since February 2026. It's going to be 120 units, which is on a scale. It should and would be self-sufficient in the way it's functional. So maintenance wouldn't be falling on other projects or other fundings model, or reaching out to our government partner to say, okay, I need a roof in 50 years or 30 years or 20 years. It would be the building beyond our time. So we're building things for as sustainable as possible so they can be self-sufficient for the long future. It's also our first seed in the Northern Territories. Again, we are not looking to have a housing model here and there. We're looking to fill the gaps wherever it exists. We do have a long portfolio of places and towns across the province that we would like to invest in and to have housing models that exist, what's appropriate for that community. So not every community will have 120 or 200 units. Some of them will have different models. After that, and I'm just starting with what's ready more and what's closer to ready, our Gander partners, same story. I spoke with Brad with the town of Gander, and he's with us here. I said, Brad, he actually invited us to see what's there and what we have been doing and the mindset we are approaching those problems with. And I sat with the councils at the time in the room, and they said, we promise you that any challenge will be resolved if it's on our end. And they stepped up to that. They said, this land, they give us the letter of interest that this land can be utilized for that project, and we submitted it under our portfolio to Build Canada Homes as well. The goal is for 80 units, and these are all projections. If it ever enough to do more, we will do more. But for now, these are the numbers that we know that we want to do, and we're ready to go according to the studies that we have done for these projects. I'm not going to mention accessibility anymore because it's a default. It's not something that we're going to discuss moving forward. Every unit we're going to build and every building is going to be accessible for seniors to live in. Pleasantville is something that we attended with Canada Land. We reached out to them over a year ago. We had a conversation with them, and now we have a parcel of land that is designated to us as well, that we are putting it to in our portfolio with Build Canada Homes, and something that we would like to hopefully see coming in the near future. Our estimate for all these projects is between 3 to 5 years, hopefully to be present. I wish we surpassed that, and we could. I'm trying to be as accommodating as possible to everybody else. It's up to me. We will start today, but there is a lot of other aspects that need to fall in place in order for this to happen. We're also approaching a very unique model of modular housing where we had that conversation before Build Canada Homes requested that. We even had a conversation about coming as a partner before our federal government came there, so it's good to be ahead of the curve. It makes you feel like, okay, we're actually in the right direction and people are joining. And that also tell us that you don't have to be always accommodating to what exists. Find where the problem is, create the solutions, talk about it, and people will join once they see a solution in it. Because if you have a problem, it means what we have is not working. And we need to make some changes. And it's okay to start those conversations in the best friendly way possible, and also in offering those solutions so it can be adopted and open doors for everybody to actually access those doors and try to use those solutions. There you go. I just have to point at you. Okay. As I said before, we do have a few projects that are in discussions now. I cannot disclose where they are, but there is few. Some of them are in St. John's and some others are outside of St. John's. We are looking, and that's not the goal, as we are the biggest population or representing the biggest population in the province, which are seniors. We have a responsibility to be responsive and then proactive. So we are building in a proactive way. We're not just looking to cover what we need today, let's say 10,000. If we can reach 50,000, it's something that we will do in the fastest way possible. So there is no limit. The sky's the limit to where we want to go. but we will be creating solutions. As we said, if it's not usable by seniors, it can be passed on to somebody else, and somebody else can use it at some point. For us to do that, we know that the knowledge is not exclusive to Newfoundland and Labrador. We do have knowledge here, we do have learnings, but we also lack some. We need to learn how others have done it. So we have looked around the world, and we have looked, and we didn't find much better than Finland. Finland had a great model that when Canada stopped investing in social housing in the early 90s, and before that, Finland didn't. They kept investing in that. They have surpassed 300,000 units. So I'm going to keep that to our partner to speak about. But they have invested, and they have created a lot of housing models that are actually now working and are actually now functional. So as we start from here, I'm going to talk about that we want to bring this to Newfoundland. We have actually secured an MOU, a memorandum of understanding, which basically means we now have an agreement with our Finnish partner, the Y Foundation, to develop a knowledge exchange avenues and routes. We will have our teams joining their teams in Finland, their teams coming to our teams here in Newfoundland and Labrador to learn and to teach each other what we know and what not, and to also help each other of how they reach the success they have reached so far. What are the steps? How can we do it? So we are not working in silo here in the province or nationally as a country, or even internationally as a province. It's the same problem, it's the same challenges, and solutions don't have to be very hard. If it worked somewhere else, it's much easier for us to accept it. So, and that's one of the biggest reasons we have partnered with the biggest foundation now in Helsinki and Finland in general. So we will be inviting our guest in a second. So what does that mean? It means that there's a global leader that will be present with their knowledge with us. It means that a proven success will be something that we explore as we move forward. There is a long-term system level change that needs to happen, that they will be assisting, and we'll be learning from them as we move forward. And also they have a very strong government and sector alignment. They do have a very good relation between all their departments working together. And we'll also listen to Joha today for somehow they achieved that. And in practical, we're not going to just have a conversation. And that was my idea when I went to Finland last year, was I don't want to come to Finland and just say, hey, I've been there. This is what they have done. It's a great model. It was like, we can do more than that. So we partner with them to actually start to bring the action to our journey as a province and as an organization. What does that mean for Newfoundland and Labrador? We have knowledge and expertise transfer. We also are strengthening our housing system. We're not trying and erring down the road. We actually can reach out and ask a question, and it's at our fingertip to say, okay, we have seen that work somewhere else. Finland is very close community to who we are. Their weather is the same, their population, they have the indigenous population there. They have a lot of similarities with what we have here in Newfoundland and Labrador. So we want to accelerate our progress towards functional zero, which in simple words means, because I was asked to explain that, that we are not going to end homelessness, but we're going to make sure that when people access homelessness or they have housing crisis, it's manageable. It's an in and out exit that we know exactly how it looks like, and it wouldn't take a year or 2 or 3. That is our goal. I sit with our team every week, and we started at who's in the shelter system for 6 months, and now we downed it to 3 months. Because we want to create the mindset of it should be 1 week at some point. Why is someone in a shelter longer than 1 week? Why do we have a housing crisis for somebody? That's achievable, but there's a lot of work needs to happen in order for that to be functional. So in order to reach functional zero, we need to create programs like the housing programs, affordable housing, supportive housing, transitional housing, but also partner together on a local level, on a national level, and in this case, on an international level as well. So say no more, Joha, thanks for listening to us for the last hour and odd minutes. And we will invite Joha to speak to us. Please welcome Joha with me.
Thank you very much, Mohammed. My name is Juha Kaila, Head of International Affairs here at the Y Foundation, and it's a pleasure for us to be joining the forces in this great collaboration. And like Mohammed said, we also feel the same, that it needs to be, a two-way action. So I feel like there's so much we can learn from the work you are doing there, especially when it comes to elderly housing, elderly homelessness, and these kind of things. So we are really hyped about this collaboration and partnership and looking forward for the next adventures. And then, yes, I have a presentation, and then Muhammed said I can have all the time I need, so you can bear with me for the next 6-7 hours, I hope. Just kidding, I will try to do this in 30 minutes, 35 maximum. And yes, there are the slides. So I'm going to be speaking probably about ending homelessness the Finnish way. So that's the title of the presentation. I will focus on, of course, the work we have been doing with the housing first, how we have achieved quite good results when it comes to reducing the number of homeless people in Finland, especially in the biggest cities. And then I will also talk about the benefits, what that quite drastic change have done to our cities, to the public, and so forth. And of course, I will focus also on the side of the house, meaning the affordable housing, and like Mohammed said, something that we didn't stop doing in the early 90s. And let's see, yes, I can see my slides there, so I can see if they change. There you go. So the climate here in Finland is quite the same as you have there, and this is a picture from 1980s. From the central railway station in Helsinki. And back then, the winters, they were a little bit harsher than today. Back then, it was quite typical that during the winter time, the temperature also in Helsinki was around -20, -25 degrees, a lot of snow, many weeks in a row. And back then, we had over 20,000 homeless people. And the reality was that quite many of them died on the streets. And that's why the 80s is sort of a starting point for the Finnish journey of trying to end homelessness, because some of the politicians and activists, they decided that, hey, we need to do something. This is not right that our own people are dying on the streets. We need to be better than this. And so in 1985, one of the actions they took is that they founded us, the Y Foundation. So we have been doing housing first since 1985, as we put it. And Y Foundation is a quite unique organization in many ways, but I think the first comes from the founding year, because the founding members include the 5 biggest cities in Finland, also quite big NGOs like the Red Cross, the Finnish Association for Mental Health, and also the Finnish Construction Trade Union, which is quite unusual, and then the Confederation of Finnish Construction Industries. And that has created a quite good balance and a good combination of different expertise that these organizations still bring to the Y Foundation, because they are still on the board of the Y Foundation. So that's the first thing that I think Y Foundation is quite unique, that there are these cities that are behind our work in a way. Yes. And this is the situation today, but when we started in 1986, the situation was a bit different. So we started with 6 apartments, 6. So we got a little bit of money from the city of Helsinki, and we were able to buy 6 apartments from the private market and then rent those for people in need. And today we have 2 different housing streams, so there are 2 ways we are acquiring homes. So the first one are the Y homes. Those are individual apartments around the cities, and then those are the apartments we buy from the private market, and then we rent for the people who need them the most. Usually in this case it means the homeless people. Then we have the M2 homes, and those are the homes that we build ourselves. And at those homes we have almost 12,000 as we speak at the moment. And these homes are meant for low-income people, also for homeless people, but mainly for low-income people, meaning single parents, nurses, police officers, firemen, and so forth. People who aren't yet, if they could pay the market prices on a rental market in a big cities like city of Helsinki. But that's why we have kept building state-subsidized affordable housing that each and everyone, no matter what kind of work they are doing, they can still afford living in the capital city. And that's something I'm really proud of, that there has been, we've had bold politicians around the centuries to make sure that, and our decades, to make sure that we continue this great work around affordable housing. But that's the main thing we are doing at the Y Foundation. We are a landlord and we build state-subsidized affordable housing and also buy apartments from the private market. But we do many other things beside that. So we like to say that we are specialists in homelessness work, and that comes because we have this development unit where I work, for example, and my role is to be in the middle of the international side of the things, but then we also have a research team of our own, so we have 4 full-time PhD researchers doing all kind of research around homelessness, housing first, housing, affordable housing, but then also things like green transitioning and carbon neutrality. And we do a lot of research cooperation globally as well, so it's not only that we do the research in Finland. Then we also run different kind of projects, mainly around homelessness, and lately we've had projects around women homelessness, and then loneliness in scattered housing, as Mohammed already spoke there about loneliness and the importance of activities. And then we just started, I think it was September last year, this living force for the elderly project. So I think that's something that we try to connect for this cooperation quite closely as well. It's a really, really exciting project and all about the activities we can offer for the seniors living in their own state-subsidized homes. Then we also coordinate the National Housing First Network, which is a really important one because it brings together all the key stakeholders around homelessness and housing as well, I would say. Meaning the state organizations, municipalities, NGOs, service providers, decision makers, Justice Department, health services, another landlords, and so forth. And together we develop the work so that we are sure that we share the same vision, and when we develop things together, it creates a co-ownership, and most of the things we actually develop will go into practice, and so they don't end up collecting dust in the shelves. That's really important as well. 4th largest landlord at the moment in Finland, and non-profit organization, no political strings whatsoever. And here's the social housing in Finland. So we have 13% of all the housing is state-subsidized affordable housing, approximately 400,000 apartments all around Finland. 25% in new housing areas means that the biggest cities, whenever they are planning a new living area somewhere in the city, the goal is to have 25% state-subsidized affordable housing, because we understand, and the politicians and the local politicians understand, it's the best way to also battle against segregation when we make sure that different people with different income levels can and will live in the same areas. Children will go into same schools and so forth. So in Helsinki, for example, we don't have any suburbs or areas where it's like dangerous to go during the night time by yourself or anything like that. And that's part of, and this is big reason behind that we want to build state-subsidized housing all around the cities, not only in the outskirts, because that way you can create different kind of challenges in your city. And how we do it is that when we as a Y Foundation, we start a building project, so we go to a bank, we usually ask a loan around 90% of the construction cost, so we need to have 10% of our own money, and then state guarantees the loans for 40 years and also subsidize the interest rate. And then if I remember correctly, they subsidize the interest rate at the moment whenever the interest rate is going beyond 2.4. So if it's 2.8, for example, then the state will subsidize the 0.4% of that interest. And then when we are buying apartments, these individual apartments from the private market, Y Foundation, many other NGOs do that as well, but I think we have the biggest housing stock of those apartments. Then there is that national lottery in Finland still, and it's a monopoly, and all the profits goes to the state organization, and then they hand out the money for different NGOs and foundations. Usually it's for youth work, youth sports, culture, but also social and health work. And so every year we must apply money from that organization, and it varies a lot how much we can get. Some years it's like 0, so we get nothing. Some years it can be 10 million. 10 million euros, and with that money we can buy quite many apartments. And how it works in reality is that when we find an apartment we want to buy, and let's say it costs 100,000 Canadian dollars, so we can use 50,000 from that money we got from the state organization, and then we need to put 50,000 of our own money. And if we don't have it by ourselves, then we go once again bank, ask for a loan, and that way we pay the 100,000 Canadian dollars. And that's how we are able to keep the rent really low for the people as well, especially in those apartments. And when I'm talking about social housing, affordable housing, or state-subsidized affordable housing, in Finland it's the one and same thing. And behind these words, there's no stigma around it, because we have been building it since 1949. So it's a normal part of the working housing ecosystem. And if you walk around the city of Helsinki, as Mohammed knows, it's impossible to spot which buildings are the state-subsidized affordable housing and what is private housing, because the quality has to be really good. So we have quite strict building and construction regulations in Finland, meaning that we have four seasons in Finland as well. So these buildings, they need to last 50 years, hopefully more, before we need to renovate them completely. So that's why the regulations are quite strict as well. And in Finland, we have always understood social housing as this necessary social infrastructure, meaning that affordable housing is as important as schools, hospitals, roads, transportation, and so forth. So it needs to be part of a working city. And this is a picture. This is a dude island. Mohammed can tell you all about this dude island. We spent a day there. I gave them a good walking tour. But this is just to showcase what the social mix in practice means in this neighborhood. It's a quite new neighborhood. They started building it in 2008. They are still working on it, but when it's done, there will be 25,000-30,000 people living in that island. It's on the seaside, 1 kilometer from the city center. Beautiful neighborhood. I have been living there myself back in the days when I was younger, but it's a really beautiful neighborhood. And then the number of homeless people started going up in Finland as well for the first time in 12 years. And I will explain why later on. But this is like the chart. We have been doing point-in-time statistics since 1987. So I understand it's not the perfect answer how many homeless people there are in Finland, but it gives us the trend, so we know where we are moving, and now we are moving upwards, unfortunately. But here you can see in the early 90s the number of homeless people started declining as well, and that was when we have a national recession here in Finland. But the politicians understood that there is a huge need for affordable housing, so we really ramped up the production of state-subsidized affordable housing, and we built 10,000 apartments a year, more or less, for quite many years in a row. And after that, the numbers stayed quite steady, to be honest, and then 2008 is the second big phase when we went all in with the housing first. And it took some time to really get the results, but as we can see, now we were able to once again start decreasing the number of homeless people until recent developments. And here are the numbers, just for the vision purposes. And long-term homelessness in Finland, someone has been homeless for over a year, more than many times during a 3-year period, and then short-term homelessness is anything under 1 year. And of course, it has been a big decrease still if we compare to 1985, almost 80%. If I would have given this presentation for you 2 years ago, it would have been 81%. So let's hope we can get back there soon enough. But this is something I'm really proud of. The number of homeless families in Finland, in the whole of Finland, is 68. And this is something that we have been working on really hard. And I give you just one example, that if there is, for whatever reason, a family with children about to get evicted, the landlord has to always, it's mandatory to notify the social services, so the social services can rehouse the family immediately with the support services they need, so that no children ever will need to go into a shelter or temporary accommodation. So these families, they have been rehoused immediately, but they haven't been able to find, let's say, the next permanent apartment quite yet. But this is something that I think is really important, and whenever there's politicians or people who ask, where should we start because the problem is so big, I tend to start with the families away. In that way, you are able to break the chain of homelessness, and it can bring good results. But unlike in many other countries, in Finland, when we moved to housing first, for example, it was a political decision. The government made the decision that, hey, the old system is not working, we are missing something out, and then the housing minister back in 2007, he said that, we need to do something differently. I cannot stand this, that we are not able to house people in our country. And he appointed a group of 4 wise men, it was called back then, and those 4 wise, they came back with a report called Name on the Door, and that's still the basic framework for the Finnish housing first model. So it was a governmental decision to go all in with the housing first. They knew that the worst thing that could happen is that we see that it's not working properly for us for some reason, and then we can always go back in a way, so we can go back to the old system a little bit. But as we know, the rest is history in a way. So since 2008, there has been a national governmental program around homelessness where the housing first is in the core. So in Finland, we don't have housing first projects, but it's like this holistic approach how we do the work around homelessness. I will not go into details of these programs, and then I can share the slide deck with Mohammed. So if you want to have the presentation, Mohammed can share it with you, of course. So this is what we were able to do, systemic change. So before the housing first, we were working with the staircase model. So if you use drugs first, get into rehab, did it make it too bad, then you need to try again, so forth, and at the end of the ladder there's the home of your own. So we moved that around, and then the housing became the first thing, and then the tailor-made support services. I give you an example. In the 1990s there was over 2,000 shelter beds here in Finland, and now the number is 200. So it has been like minus 90% when it comes to shelter beds. And it's also important to remember that when we started housing first, it's not like we had all the money in our pockets. It was a huge banking crisis globally, but we made the choice that we want to put effort towards ending homelessness because we could see the value, what it brings. Of course, first and foremost, the people who can have their own home with the right kind of services, but also on a bigger scale at the long run, how we are able to maybe save some money and also create better cities for each and every one of us. And this is the Finnish housing first. I won't go into details too much about all these 6 points. I will just say that the main difference compared to Canada, for example, is that in Finland the housing first is designed for anyone facing homelessness or who are on the risk of homelessness. So we have integrated the prevention services into the housing first because we feel like those 2 things should be shaking hands. And then, of course, I understand the number 3 that we have a sizable affordable housing stock, and that helps many things when it comes to housing first. But then again, there are many countries and cities that have even bigger affordable housing stock than we have in here. I'll give you one example, city of Vienna doing amazing work around social housing. Almost 60% is social housing in the city of Vienna in Austria. And at the same time, 11,000 homeless people. Because they don't have access into the affordable housing stock. So that's why it has been so important that in Finland we also target those homes for the people who need them the most. And here I will highlight, because I think the number 5, the low casual work activities, is really important. If we are talking about homelessness, senior housing, youth housing, or any kind of housing, I think the activities matter for people as well, because loneliness can be really a killing thing, as we know. So I will show you a couple of pictures about what kind of housing options we have in the homelessness work, and then describe the location of work activities a bit more as well. But my favorite part is the 6 normality. So people, no matter what kind of housing solution they are living, they sign normal rental agreement as anyone else. They use the same social and health services as anyone else, and so forth. Can claim the same benefits as anyone else. They have the same rights as anyone else, also responsibilities as anyone else. And then, of course, they need a little bit of extra support, tailor-made support as long as needed, but then again, who doesn't need some kind of support every now and then? And this is before we move to the housing part, is that you can't really have housing first without having housing first. And I think this is great image, because especially in Europe, whenever there's a seminar or conference around homelessness and housing first and so forth, we tend to speak quite a bit about the support side of the things. And I think that's really important. I've been a support worker myself, so I understand the value in that. But I feel like we have been doing that for the past 16 years, and we haven't touched too much about the housing part. And then when we look at the word housing first, the housing really is the first and core in that service. So I think that's something that we should be talking a little bit more, and also be bold enough to try different kind of housing solutions. So here is how we have in Finland 3 different housing options. Scattered housing, so the individual apartments around the cities, then the support done by home visits, then we have the housing first units, and then we have this new, I'm not too keen about the word hybrid, but it is there. But I will show you some pictures around these housing solutions. So scattered housing, the building with the yellow stripe, we have built that. There are 62 apartments in that building, and there's 2 formerly homeless people living in that building. And then the support workers from other organizations are doing the support for them. Nothing new with that. And then the housing first units. This is not one of them. This is from the 1960s. This is just to showcase what the dormitories look back in 1960s in Finland. So like huge rooms, barely any mattress, or not even talking about beds, but just huge rooms and people lying there and calling it a day. Then in the 1990s and 2000, the shelters were a bit better places, maybe 4 people in the same room, and then they have at least beds and so forth. But when we went all in with the housing first, we understood that we want to get rid of the shelters and temporary solutions. Not completely. We understand that there is a certain need for those, but we want to get rid of most of them and change them into permanent solutions for people, and that's how we created the housing first units. So this building, for example, nowadays looks like this. So it's like a normal apartment building, 33 apartments for former homeless people, and then there's the support 24/7 downstairs done by the Salvation Army. And in these buildings, they do, for example, this low threshold work activities. So tenants, they take care of the communal spaces by themselves. They clean them. They do a bit of maintenance work. They do T-shirts. They do. I believe in this unit they have a heavy metal shop. They do woodwork. And there's also a connection with private companies, and private companies offering different kind of work from the unit. And it's not mandatory to participate, but if you participate, you will get paid as well. So it has been like this kind of win-win-win situation, that people, they get something to do during the days, and if they use substances, for example, they use less because they want to work. So it's a great way to do the harm reduction work. And it also means that these units are more peaceful places if you look at the atmosphere, because especially last time I visited this unit, it was like empty. There was only the employees, and I asked, where is everybody? Oh, we just finished the work, so they are taking a nap. So it brings order to people's life in a good sense, that you have meaningful things to do, you want to participate, you get a little bit of extra money and so forth. So it's a great solution for the tenants and for the employees and for the neighborhood as well. As part of the work activity is actually to go around the neighborhoods and collect trashes to show people that, hey, we are doing our part, we are part of the community, and then this is the way we show it. And it's also important to notice that they do a lot of neighborhood work, meaning that, for example, once a month there's an open door day, and the neighbors can come in and have a chat with the employees. Usually there's a couple of tenants as well to share if they have some kind of, if something has been happening around the neighborhood or anything, positive side of things or whatever the case might be. And the apartments, like normal studio apartments, kitchen, bathroom, there's a fridge oven, but then people buy the rest of the stuff by themselves because it's their home and it should look like one as well. If they don't have any income of their own, then they are living with the benefits, and then they get a little bit of extra social assistance when they move in, so they can buy those things that people really need in the beginning, and then little by little buy more stuff if they wish. And this is another unit. This used to be the biggest shelter in the Nordic Europe. In the peak days before 1936, in the 1950s there was almost 500 bed places, but in the later decades it was maybe 250 bed places. And after the renovation, there's 81 individual apartments, support downstairs 24/7, work activities, and so forth. And here once again, it was a political decision. The city of Helsinki, they wanted to go along with the government decision to go housing first, and they gave this kind of carrot and stick for the Salvation Army. And the carrot was that if you do the renovation from a shelter into housing first unit, the state will guarantee 50% of the renovation cost. But if you don't want to do it and you still want to operate it as a shelter, the reality is that we will not buy any services from this unit because we want to move into the housing first. So there was this kind of gentle political push as well. But it was an easy decision for Salvation Army, and they had a quite long internal discussions around it, but at the end of the day, the rest is history, so to speak. I think I'm such a cliche machine today, but bear with me. And once again, to showcase like normal apartments. In this apartment, it's you should have seen it in the time of the Barbie movie. It's like really big, and then there's a lovely elderly lady living in this apartment. This is one of the hybrids we have now. So we have built the whole three buildings in this block, and the ones with the black boxes, they're like normal state subsidized affordable housing, and then there's small housing first unit, 20 apartments roughly. And then there's the day center, which is like the heart of the block, and now it has become heart of the neighborhood. So it's open for everyone living in the neighborhood, and the neighbors and the people living in this complex, they have really taken it under their wings, and they have their different kind of cooking clubs, reading clubs, movie nights. They make cooking lessons, photography lessons, how to fix bikes, different kind of things. And the people living in the housing first unit, the former homeless people, they have said that it has been a great way to integrate into the neighborhood as a normal way. And I totally agree, and I hope this will be the future in the next chapter in the Finnish housing first more broadly. And these are the newest developments. The first one is called Dices. They look like a little bit like garden houses, but behind those 6 Dices there is a small housing first unit, 20 apartments, once again 24/7 support downstairs. And these 6 are meant for people who have been go through the system, so they haven't been able to stay in a scattered housing, not in the housing first unit with this 24/7 support. So we sit down with the people and ask, what kind of housing you feel would fit you. They have quite severe mental health challenges, and then 4 out of 6 people are also using quite heavy substances, but they were, saying that all of them were saying that they understand the need of the support for them, but they need their own privacy in a way that when they open the front door, there is no aisle where someone might be walking past their door. And that has been causing a lot of issues in a negative way, and then causing those evictions. So this is what we came up. 6 individual studio apartments in the same area as the housing first unit. So when they open the front door, there is no one there, just forest and peacefulness. And they have been living there in the past 18 months, no evictions, so that really worked. And the second one is a building built by the Youth Housing Association. There's 110 apartments, and 12 of those 110 apartments are for formerly homeless young people, and they are scattered all around the building, and no one knows which apartments are for the ex or former homeless people. And then there's support offered 5 times a week from Monday to Friday, 7 a.m. till 9 p.m. and other times there's a phone call available. And that also idea came from the young homeless people by myself. They really value that the support is close by when it's needed, but they didn't want to have this kind of whole building just formerly homeless young people. So they wanted to fit into the normal housing, sort of speak. And then I will rush the last couple of slides. What has worked here? I think the systemic change is the cornerstone or the silver line, because without that, these other bullet points wouldn't have happened. So that was all in that. It was a political decision that we really want to go toward ending homelessness, and it means that we need to try to limit the number of temporary options we have and go with the permanent ones and reallocate money from those shelters and temporary solutions into permanent housing and also prevention. Talking about prevention, I think the biggest thing we have developed are these housing advice services. Of course, the affordable housing is the best structural element, but when talking about services, housing advice services, meaning that anyone struggling to pay the rent or mortgage or have any kind of housing-related issues, they should have opportunity to contact housing advice services, and then they try to work the situation out with you so that you wouldn't end up losing your home. And it's a really scalable, really effective way of doing the work. And only last year, these housing advisors were able to prevent over, I think it's 4,000 evictions in the Helsinki area. And so that's a lot of important and good work. And that's what I meant when I said that prevention and housing first should go hand in hand. And then the culture of collaboration. So we can't think about homelessness from the silos that health is responsible of these things and housing, and we all need to be sitting at the same table and share the work we are doing and understand that only together we can have good results and make sure that more people have a home of their own and one day all of people. Not a fairy tale. A lot of hard work, blood, sweat and tears, because I'm the cliche machine today. But no, in reality, we have the right-wing government in the past 3 years in power. Exactly 1 year from now. From now, we will have the next parliamentary elections, and we'll see what kind of coalition government we will get. But this right-wing government has made some, wrong decisions, cutting social benefits, cutting funding from NGOs, doing really important work on the grassroots level, and then also the idea for them would be to build less affordable housing in the future as well, but we'll see if they have time to actually execute that one. This just shows that political trends come and go. We have a quite good situation in Finland from 2008 until 2023, and I think it's not a funny thing, but it's strange that when we started the housing first 2008, it was National Coalition Party who was in charge. And it's the exactly same party that's in power now. Totally different leadership, totally different point of views. People have changed in the party, but that just shows that we need to keep doing the development work and advocacy work and everything doing all over again. But these are the main reasons why the number of homeless people in Finland have increased in the past couple of years. And just sliding towards the end. So Helsinki has more or less ended street homelessness, and then this is how we communicated change back in 2008, and now how we are communicating the importance of the work once again today. So with this work we are doing, we are able to have safer and more pleasant cities for everyone. And visitors, tourists, businesses, investments, people living in the local communities, and so forth. So there is something for everyone, because the reality is that we need to communicate these things a bit differently for various reasons. But I think one of the reasons is that we are quite selfish nowadays. So people usually ask, what's in it for me if you use my tax money to help people? And this is the other argument, of course, that on the long run we are generating saves, and it's a wise use of taxpayers' money when we actually do the right thing and enable that housing really is a human right. And this, if I would be there and I'd see you, I'd ask this question, homelessness is a choice, who agrees with me, and then I would be the only one raising my hand, and then you would be like, what are you saying? And then I would put this one there, that we choose it with our policies, and the homeless people are the ones who face the consequences of these policy choices. So we do a lot of collaboration, European and international level at the Wire Foundation, and in the future we are more than happy to share one more logo in this slide. If you want to read more about the Change to Housing First or Wire Foundation, there are 3 books available from our website with a handy price of $100 per book. No, bad joke, they are free to download, of course. We wanna share the good practices. I'm sorry about the quality of the joke today. And that's it. And that means Home for All. So next time I will see you, I will ask what is Home for All in Finnish, and you will have the perfect answer. Thank you very much.
That was exciting.
Thank you so much, Joa. I really appreciate it. If you're not inspired, and if you don't think that we can actually do better and end homelessness and collaboration is the solution, that's okay. But I think 5 years from now, you say, I hope I joined that, or I helped to be part of this, even if by 1%. Solutions are there, and there's always people that will champion it, people who step up to do it. It's not something that is exclusive to one organization, it's everybody. And I think we will do it as a province, not because I have a magic wand, I wish I did. But I think I know the nature of who we are, and I see how far we have become as an organization because of this province and the people that are in here. And I think we'll be able to do what Finland have done in the next 5 years to 10 years. It's a matter of time. And again, if you want to do it, join. If you don't, that's great. But it's much better than like watching from the outside. I think it's to be part of this one way or another. Again, thank you so much, Joa. I'm going to move very quickly. I'm just going to give a little bribe. We have really good food that is going to be on the table now. We can have another 15 minutes max. We're going to have our little discussion of our provincial partnership. I'll invite our partners, Sheldon and Jen. Please, my good friends, have a seat. Please welcome them. We will have them now to discuss our shared vision and how we're planning to develop housing across the province. Please welcome them with me. So today we will, this is not meant to cover everything we want to do, it's meant to give an insight of what we're trying to do here as partners, is how we're trying to move forward. This is a mini panel to what we're going to be doing this week. We're going to be speaking to you us in the CHRA conference. There is a national conference here happening downtown St. John's.
What conference is that?
I'm not sure. But I would like to start by that every community faces different affordable housing development pressures, policy, land, capacity, or capital. To name a few in your context, what has been the biggest constraint, and how will participating in this community-led portfolio help unlock solutions at the scale required to meet the needs for our community? I'm going to start with our leading organization, Raising the Roof, Sheldon, and then move to Jen, and then move to the next question.
Pleasure to be here. Absolutely fantastic morning. It's what a way to start off. It's going to be a full-on housing week for sure. So Raising the Roof, for people who don't know, an organization has been around for about 30 years. Much of that history has been about advocacy and policy and raising money to give to others so they can do innovative things. But about 5 years ago, I think we had to take a really hard look at ourselves as an organization, slightly before my time. And the decision was made, a bold decision, to pivot to getting into the business of developing and operating affordable housing. You can imagine from a policy advocacy perspective to, now we own and develop and all the expertise you need for that. So very exciting. We're about 5 years into that process. But one of the things we've developed over time, and it relates to your question, but set to context a little bit, is at the end of the day, if under the mandate of Raising the Roof, we build and operate affordable housing for Canadians, which is our mandate, our core mandate. But if I help Mohammed do it, right? Either way, someone's getting the keys to a set of to an affordable housing unit that really sets them up for future success and the ability to thrive. So that is the story of how we arrived here, how we arrived to the portfolio conversation as well. I'll be honest, one of the biggest challenges in my 30-year career developing affordable housing, certainly across Newfoundland and Labrador in particular, is it is such a heavy lift, project by project, right? And we see the numbers and they continue to grow. I think I read an article recently this week that says, St. John's in particular, I'm not sure about the rest of Newfoundland, but had one of the hottest housing markets in the country still. And the pressure that puts on a growing number of people, that desperately need affordable housing. And it affects, the community in every way, shape, and form. So after many, many years of, we have 14 units, we have 6 units, absolutely fantastic. And the good people in community and the good people in government that made that happen should all be celebrated. We need to accelerate our ability to develop housing and put it into the hands of the families and seniors and youth and everyone in between who desperately need affordable housing. So one of the biggest challenges is such a heavy lift to get through all the hoops and loops, as I say, to bring an affordable housing project to fruition. I'll be really clear as well. There's I remember my good friend and colleague, Len Simp, who's obviously since passed away, a really good friend to the community. He always defined it as, you just need affordable housing for some folks. Absolutely. But you also need to pay attention to the folks who have these additional needs around mental health, addictions, any number of things. So you need to pay attention to that as well. One of the challenges often is, even in a time when you can find capital resources, sometimes the hardest resources is to be able to find support resources, or the other way around. So trying to find that sweet spot sometimes to find the resources from the capital perspective, but also find the resources from the support perspectives concurrently, so you're housing the broadest range of people who need our support. So there you go.
Yeah, great. So my name is Jen, and I'm the Executive Director with Choices for Youth. And of course, Sheldon used to be in the Executive Director role with Choices for Youth, so if I get anything wrong,
I don't think she ever will.
So certainly, I think, just to respond to your question, Mohammed, I think that there's really 2 things that we see a lot when we're working with young people under the age of 30 and their families. Number one is that I love the graphs that Johan put up around the focus on, we traditionally focus more on emergency services and emergency housing and less on prevention and affordable. But really what they've transitioned to, which has made them so effective, is focusing more on prevention, more on affordable, and less on emergency services. And I think that's really the challenge that we come up against every day at Choices for Youth. So the number one cause of youth homelessness is family breakdown. And what we mean by family breakdown is that something happens within the home where a young person leaves or a young person is kicked out. But no matter what happens, the young person's no longer living with their family. And so what we really have been trying to focus on at Choices for Youth is, yes, developing more housing, which is the focus of our conversation here today, and also making sure that there are pathways for prevention so that a young person maybe has a different option than becoming homeless in the first place. And in some cases that can be, just to illustrate with one example, it could look like a young person who, yes, they leave the family home, but there is an aunt or there is their best friend's mom is really happy for them to come and stay with them for a bit, and as long as they're in school and as long as they're doing okay, they can stay there for as long as they need until they can transition to a more long-term solution. Like, that's exactly what we're talking about. Ultimately, we would prefer that young people don't become homeless in the first place, and the best way to end youth homelessness is to prevent it, from happening in the first place. So that's the first thing I'll mention. I think the other really big gap that we're seeing is just the influx of young people into urban centers. And in our case, unfortunately, that influx is concentrated in St. John's. So 30% of the young people who we work with, and we work with about 1,200 children and youth every year, have recently arrived in the city. And so the story of a young person getting kicked out or leaving their family home, they often get put on a bus, sent into St. John's to access services. And no matter how good we are at what we do, it is ultimately not the best place for that young person. They would prefer to be closer to home. And so certainly when we think about how we address youth homelessness, it's building of the housing stock. We've seen certainly about a 25% increase in the average rate of rent over the last several years, and we've seen a plummeting vacancy rate from about 7.5% to, I think we're teetering around 1.5% today. That impacts young people. We need to prevent it from happening in the first place by providing pathways back to family and really asking that first question when a young person becomes homeless of, is there a safe person in your life that you can stay with tonight? Instead of immediately allowing them to enter into the emergency shelter system, we need to find pathways back to family. And then the third piece is really making sure that when we think about tackling this issue, as Mohammed mentioned earlier, making sure that we're tackling it not just in St. John's, but really across Newfoundland and Labrador. Not only is that more equitable, but it actually better serves the populations that we support, because ultimately they would be better supported if they could stay closer to home as well.
Amazing. So if you say we have one common issue that if it changes, a lot of things will change, you'll be shifting the focus from immediate response to long-term solutions?
Oh, absolutely. I mean, one of the things we've known and known for 20 years, I tell a story all the time because I've been at this a long time, so aging myself, is 20 odd years ago, the community got together, our good friend and colleague, I'm looking at John Skinner back there now, Bruce Pierce, we brought a colleague from San Francisco to St. John's. I tell this story all the time because it's really important. I'll keep telling it until we get this right. 20 years ago, we brought Mark Trotz here because the City of San Francisco Health Department had figured out dollar for dollar the best health outcome they could achieve is the health department to get into the business of developing and operating affordable housing. That was 20 years ago. So the whole notion that we don't know how to solve the problem is a fallacy. Where's the long-term planning, over the next 10 years, 5, 10 years, whatever it takes, as aggressively as we can. I come from the world, I work in a nonprofit, but really it's about entrepreneurship, right? We solve problems, we're innovative. And so in my view, the best way to achieve a goal is set a target. So you're really clear, for yourself and for everyone around you, what it is you're trying to achieve, the problem you're trying to solve. I agree with the minister. We all have a lot in common. We all may see this province from different viewpoints, but we all care about this province. Right, and it's a very passionate place. And so what is it we're trying to achieve when it comes to addressing, the affordable, housing in this case, but affordability in general, absolutely. Affordable housing crisis in the province, that has been with us for a very long time. I often talk about it, like people say, oh, did this start, after COVID or pre-COVID? It's like, no, this started 20 years ago. Right, for anybody who's been paying attention, certainly, obviously we're in the business of worrying about these things. But this is 20 years in the making. Right? And we see it happening across the country, and as special as this place is, there's nothing about Newfoundland and Labrador that insulates it from what has transpired in other parts of the country and Finland, other parts of the world over many, many years. And you can look at the financialization of housing and all these other causes. But at the end of the day, we need to aggressively figure out how to meet the needs of Newfoundlanders and Labradorians. The other thing I'll speak to is homelessness is atrociously expensive. Atrociously expensive. When you look at, not just the impact on the individual and, those in their immediate, families and vicinity, the human cost of it, but also the exponential cost to communities and to government and everyone around, the issue. As they say, investing in shelters, as much as it's necessary in the moment, is your most expensive investment with the poorest outcomes. Because really what you're buying is someone who has a roof over their head one night at a time. Right? And that is not going to be long-term a good use of the limited resources for this province. Never has been, never will be. So tackling that in terms of, the long-term planning and coming around a table. I live in a time where we had, all party committee on mental health and addictions in this province. Like, is there a world where we would consider, like, can we come together and say collectively, what is the target in terms of how to get ahead of this issue? I've spoken many times about, the operation of the hotel. People are in favor of it, people are not in favor of it. At the end of the day, it was born out of the investment we chose not to make 20 years ago. Right? And like one of the things I talk about all the time, a bit of a rant now, Mohammed, sorry. I talk about all the time is that like there's nothing stops us if we continue down that path. Well, guess what? We're going to need another one. And then we're going to need another one. Right? And this is a pretty small province, but like that is the pathway we're on. And it's expensive. And it's a good operation. I know the folks that are operating that facility. It is a good investment, again, because we didn't do what we needed to do 15, 20 years ago. So, back to you.
Dan, you have anything to add?
I would just add that I think what we're noticing, and certainly the Finnish model proves this, but there's so many other incredible models across Canada that have emerged over the last decade plus. A really interesting model that currently is operating in Toronto that is noticeably reducing, is a partnership with the hospital there, noticeably reducing rates of homelessness, but also noticeably reducing rates of emergency room visitations. And that's something that we at Choices for Youth, we directly house about 100 young people a year. But what we see as most impactful in how we house young people is not just when we put them in an apartment and say, best of luck to you, but rather when we compare that with a myriad of other supports. So by offering mental health services, by offering primary care on our site, by offering food security, basic needs, by owning and operating 3 social enterprises where youth can gain training and employment experience, it is that combination of services that for a lot of the young people who we work with who may have barriers to employment, maybe they dropped out of high school, maybe they're navigating mental health challenges, that's really what changes the trajectory of their lives when you compare those services with housing. Housing, as mentioned, like housing has to come first, but it cannot be where we start and stop. There has to be, every single person in this room at some point in their life has required a support, a shoulder to cry on, or somebody who recognizes that you're going through a hard time and can offer you some help. And the young people who we work with are no different than that. So really, I think what we've noticed over the years is certainly through our model of integrated service delivery, we've been able to, for 81% of the youth who we work with who are homeless, we're able to successfully house them within a year. But we also see that of that demographic, 62% of them improves their mental health. And again, makes all the sense in the world if you have a safe and affordable place to call home. You have space to be able to think about how you improve the rest of your life as well. And certainly we see that every day at Choices for Youth. And I think that through partnership, that's really what's possible, because when I reflect on that model, we can only do that because we have an incredible group of primary care providers who choose to come to work at Choices for Youth every day. We have partnerships with various provincial government departments who are willing to set up shop and talk about income support within our hub on Carter's Hill Place rather than making youth go across town to access those services. And we also have partnerships with folks like Connections for Seniors where we can really think about how do we continue to improve on this model to improve the outcomes of young people. But I think ultimately we really need to invest in what we know works. And certainly there's no shortage of models that demonstrate that when you compare affordable housing with the right kinds of supports, then that is really what changes the trajectory of people's lives, whether you're 16 or 65, it really doesn't matter. It's that combination of services that many of us need and can allow many of us to thrive. So I think that that's really what's possible when we work together and when we can work in a more integrated way as well.
Very well said, both of you. You answered a lot of the questions I was going to ask, which is good for everybody.
We're just being quick.
But how do you talked about the benefits of seeing a community-led portfolio occurring, and I will have a little bit from you, Sheldon, on that. Why is that beneficial for our province? Why does it matter that we are partnering and leading this as a community organizations?
I think in terms of, you look at the portfolio submission, to be really clear, Raising the Roof with partners across Manitoba, Ontario, and now Newfoundland and Labrador have made a submission to Build Canada Homes. We have a wonderful support letter from the provincial government here to go into that submission. We have another support letter from Manitoba, Ontario, bit of a different beast, so we won't talk about that. So that submission's in. I think the unit count at the moment is 1,047 units over the next 3 years that we could bring to market across those 3 provinces. I'm very pleased to say 650 of them right now are projected for Newfoundland and Labrador. That is a decent start. It's nowhere near where we need to be, but it's a decent start towards, okay, how do we really start having some, delivering some numbers for Newfoundland and Labradorians who really need access to decent, safe homes for the long term. I'm looking at my other long-term friend, Melanie Thomas, back from Newfoundland and Labrador Housing. We've been tackling this issue as partners for a very long time. So how do we start to scale up real numbers to meet the needs that continues to grow? So very excited for that. Sorry, Mohammed, now I lost track of your question. I wanted to squeeze that in there.
I want to say, why is that beneficial? Why not just everybody do it separately?
I think part of that is organically this happened. So the beautiful thing about this, and this is why I took it from your presentation this morning. So when an opportunity comes up for Connections for Seniors, you don't have to squirrel away in the corner of a room and figure out how you're going to respond. You already know the next 10 things. So raising the roof, and I know the same for choices. Raising the roof, when Bill Canada Homes pivoted, got announced, it was all portfolio. These are all projects we were already involved with. Again, from that mantra of build a house for us, great, build a house for someone else, also great. So we sat around a coffee shop in Toronto in November and just added up the number of units if we were to just convert it into the portfolio. It's organic. So it just made sense. I often talk about the fact that there's not enough time, energy, or money in this country or this province to be taking a singular path to try and achieve what we're trying to achieve. On top of that, given the size of the challenge that continues to grow, that is not how we're going to get there. By collaborating, working together, obviously you want economies of scale so that when you go and you're looking to hire consultants and folks to actually help deliver the units, you can negotiate probably from a much bigger scale. That's really helpful. There's lots of, incentives now being provided by the federal government around, new forms of construction, modular building, trying to squeeze out all the value. So I just think in terms of it's a much more collaborative model, much better use of resources, and much more likely to achieve the scale that we need to achieve at this point.
Yeah, certainly. I agree with all of that. I think the additional layer to this is that the problem is big, and so the solution has to be big as well. Unfortunately, we have seen, certainly in the last several years, a real decline in terms of, decline on the vacancy rate side of things, but just the demand for housing. And again, just to kind of illustrate it, for a lot of the youth who we work with, they may be availing of income support, they may not have a job, they may be just in a transitionary period in their lives. And when they're competing with a mid-level professional to try to get a one-bedroom apartment, 9 times out of 10 they're losing out. And that's the reality that we're up against right now in the community, and that's the trajectory that we really want to change, because we have young people who are in our emergency shelter who are really ready to move on to more permanent housing, but we just can't move them on because there's nowhere to move them on to. So I think if I bring it back to that graph that we saw on the screen around, if we could invest more in prevention and more in long-term affordable housing and perhaps affordable housing with supports, then I think you can really move people on when they need to be moved on, rather than holding them in this state of an emergency when really they're ready to move on with their lives. So that's my reflection. And I think when we think about working from a portfolio perspective, it allows us to build more quickly. And certainly some of the projects that we have at Choices for Youth, I know Sheldon often reminds me, took many years, a decade plus in some cases to build. And that's not because there wasn't the will, it was because that's the reality of doing this project by project. But if we can work together and pool our resources and our collective know-how, then certainly there's an opportunity for us to do this much more efficiently and effectively. And I think that is really the rallying cry of the here and now, is we have a problem that's not getting better in this province, and there are solutions that we know could reverse the trends that we're seeing. And I think if we can effectively partner with the government in Newfoundland and Labrador and the federal government through Build Canada Homes, then I think community and both levels of government, as well as the City of St. John's together, we have the tools and we have the resources to be able to change the trajectory that we're seeing. And certainly we have really high rates of child poverty in Newfoundland and Labrador. And again, when we think about if we invest in those long-term solutions for youth and seniors, then we're investing in long-term solutions for families. And some of those runoff effects would be that ultimately poverty, I believe, would see a decrease as well. So that's, I think, exactly where we want to be as a province. And this is one of the ways that we can get there.
Thank you. Great answers, as usual, both of you. So basically, being united is a better approach. We have more tools to use as we move forward. We can leverage our unity to actually have some power to negotiate contracts and do things in a more efficient way. It actually benefit our government too, because they can spend less eventually and build more, because it's a dollar that you can build with. If I can build it for 75 cents or 50 cents, much better for long-term solutions. Seeing that unity is beneficial and working in silos just is everybody's working on their own what they see, and they might not learn from each other as much. We're just quoting presentation from Finland now because we are learning from that kind of unity and uniting. And more people bring to the table, the more we're gonna quote and the more we're gonna be able to surpass a lot of those issues.
Yeah, so another point I want to make in this, we have a meeting with Bill Cannon Homes on Wednesday. Well, they're really excited about that, and we've submitted a briefing note last week. So there's 2 points I'll make. One, when I sat down and kind of was putting it together, like individually, we have a certain credential. We've got X number of units, developed and under operation. But when I added up, the entire experience of the entire, it's thousands of units already developed, already in operation. So like from a credential perspective, like it's a pretty powerful portfolio from that perspective. And it's growing. Hopefully, we're in conversation with some folks in Nova Scotia who may want to join the portfolio. We had a meeting last Friday with a collection of youth serving agencies across the country. They're expressing interest in being part of the portfolio. So one of the things we're going to say to Anna Bilal and others on Wednesday is that this is just our starting point. Like the more we're at this is going to continue to grow because there is absolutely a lot of interest, and it's community led. It's a very powerful tool around, yes, I mean, if a municipality builds housing, fantastic. If a provincial government builds housing, fantastic. It's all to the good. But there's something very special and powerful with a community-led portfolio at the same time.
We have gone out of time, but if there's one more thing to add, maybe for me, I would say there is reasons that we're not partnering. None of them are good enough. None of them are the actual reasons that people are the focus and the target. One of the strategies courses that I was studying back in university, I remember the professor was quoting one of the gurus of strategy in the world, and he said, a lot of not-for-profits become about themselves versus the people they serve. And that's when it becomes an issue. They are not focused on people, they are focused on themselves to survive and grow. They're not focused on why they were created in the first place. And that's one of the biggest reasons. So I would say it's not ego, but it's the fear of non-existence, as if it's a job. It's not. It's actually you are present and you exist to solve an issue. And I would add to that too is the lack of vision sometimes to how much benefits that can add. If you guys want to add points to that would be great. If you want to add anything else, please feel free.
The only other thing I would add, and this is an important highlight for Anna Bilal and others as well, so for many communities, many smaller projects, in the current model, historically, you don't stand a chance. I mean, how many good projects, community comes together, they do a heavy lift, and they don't make the cut because they're not big enough. They're not in a big enough center, or they don't have a project that's big enough. So our portfolio includes the smallest unit count, I think is about 14 on a project in Gander, Newfoundland, which is fantastic. It includes, units of 120 in Lab West. It includes 150 unit property in Toronto. So it's a really diversified portfolio. One of the things we're saying to the provincial government is if the federal minister of housing now gets up in a national conference in November and says, housing homelessness is now a crisis in every nook and cranny of the country, small cities, small towns, big cities, well then where's your solution that hits all of that? So one of the things we're going to be really clear on is that through this portfolio, we are now providing an opportunity for all that whole range of housing solution in communities of all shapes and sizes. And when it comes to Newfoundland and Labrador, let's be clear, St. John's is a city, St. John's is a big town in many parts of the country. but it's, you know, it's central Newfoundland, it's western Newfoundland, it's Labrador, and we'd like to see that grow as well in terms of, you know, the geographic distribution. So that's one of the other points we're going to make to the federal government, is that it gives a chance to those communities and those very viable projects meeting a very real need in all of those communities.
If I could just add to that quickly, I think ultimately if we can invest more strategically in rural regions across Newfoundland and Labrador, ultimately it's an investment in the youth who are coming through our doors today. Because I think it is absolutely startling, whether you look at the point in time count that End Homelessness St. John's conducts, or you look at any of our organizations' data, I know we're not alone in this, there's just so many young people who are coming through our doors, not because they want to be in the city, but because they feel they have no other choice. And when I think about the advantage of a portfolio-based approach, it allows us to really make sure that we are shining a light on those communities that deserve the investment just as much as urban centers do. And I also just want to plug, and perhaps you guys can keep us to account on this, myself and Mohammed and Sheldon, we've been working together to try to envision what could it look like to build an intergenerational model of housing for young people and for seniors. As I referenced before, if half of the young people who we work with become homeless because of family breakdown, how do we create pathways back to family, but also what we call natural supports? People who are in their lives who could provide them with guidance, mentorship, and support. And I think there's been so much viability in intergenerational housing in other parts of Canada and beyond, and we really want to bring that model to Newfoundland and Labrador. So certainly more to come on that, but that's been something that we've been cooking up in recent weeks and months, and something we would really like to see, we think would be very valuable in our city.
Well, thank you to both of you so much. Very well said. One of my favorite leaders and friends to work with, along with others, but really enjoy talking to them, bringing problems and solutions together. Always like refreshing to listen to both of you. Thank you so much. That brings it to the end of our day today. After that, it's only fun stuff, so you can network, talk, and have food. Thank you so much for sitting and listening to us today. Thank you I hope we gave you something to think about, and we have passed on some of our dreams and works and projects. It's something that is not hypothetical again. It's something that we will see the outcome of it, God willing, soon.